Optimum nutrition is of utmost importance while managing cancer. Nutritional requirement of the patient will depend upon the type of cancer, stage of the disease, the treatment being given, and the prevailing health condition of the patient. And based on all these aspects, a patient specific diet needs to be formulated, for which one should always consult with a qualified dietitian. It is advisable that the nutritional intervention should be started before the beginning of the treatment, because in cancer treatments like chemotherapy, radiation therapy, immunotherapy, hormone therapy, surgery, stem cell transplant, etc., all these treatments may affect the patient's taste, smell, appetite level, etc., and this may also hamper the ability of the patient to eat food and absorb nutrients. Some common side effects of cancer treatment are nausea, vomiting, dry mouth, difficulty in swallowing food, diarrhea, constipation, etc., which may lead to weight loss and malnutrition. And this results in frequent infections, which may be life threatening at times. And for the same reason, many cancer patients unfortunately are not able to finish their treatment. Eating a balanced diet before and during the cancer treatment is very much important, because this would help in maintaining the patient's ideal body weight, maintaining the energy and muscle tone of the patient, would help in overcoming the side effects of the cancer treatment, and also will restore the immunity level of the patient and reduce inflammation. Although a cancer patient's diet should be individualized, yet some general guidelines for diet of a cancer patient are: number one, sufficient amount of good quality protein should be provided to the patient, for which one can go for sources of proteins like beans, legumes, nuts, seeds, and regarding non-vegetarian sources, you should choose from lean meat like chicken, fish, egg, etc. Ensure that the patient eats adequate amount of a variety of colorful fruits and vegetables, which are packed with vitamins and minerals, which should help in boosting the immunity of the patient. Include good quality whole grains, which are less processed, like brown rice, whole wheat, millets, oats, etc., and avoid ultra processed or more processed foods. Includes good quality fats in sufficient amount, which would help in providing sufficient calorie to the patient, and avoid oily and fried foods. If the patient is unable to eat sufficient amount of food, then supplements may be required, for which you should always consult with the doctor or a qualified dietitian. And also ensure that the food that the patient is eating is easily digestible, palatable, and very well cooked. Maintain hygiene while preparing and feeding the patient, because one should always ensure that the chances of any infection is minimal. If the patient is not eating properly due to lack of smell, taste, or nausea, then go for small meals at regular intervals rather than giving large meals at one go. And try to make the meal of the patient attractive, add variety to the food, and make it palatable. And if you have any other problems while feeding the patient, then you should always consult with a qualified dietitian. But please ensure that the patient is getting sufficient nutrients through his diet. Always try to boost the morale of the patient. For this, friends and family should extend their support, love, and care and encouragement to the patient, so that the patient can complete his or her cancer treatment and overcome the disease. Thank you.